and welcome to the NP-POW video and podcast. I'm Dr. Julia Rogers, your host and fellow nurse practitioner, bringing all of you those wonderful, powerful POWs, or pearls of wisdom, that can transform your practice and elevate our profession. Today's episode is all about something that shapes all of us, as nurses as well as advanced practice professionals. It's mentorship. And I couldn't be more thrilled to welcome someone whose entire career embodies the transformative power of guiding, teaching, and investing in others. Thank you so much for joining us, Patti.
Oh, thank you for having me.
Today we have Dr. Patti Ludwig-Beymer, a true nursing leader whose journey spans 5 decades and touches every corner of our profession. Dr. Ludwig-Beymer is currently a full professor at Purdue University Northwest, where she's shaping the next generation of nurse leaders. But her path to academia is extraordinary. She spent 9 years as vice president and chief nursing officer at Edward Hospital in Naperville, Illinois, where she led nursing excellence initiatives and championed magnet recognition. In fact, she's been a magnet appraiser for the American Nurses Credentialing Center for 18 years, literally setting the standard for nursing excellence across our country. Currently, she coordinates the Nurse Executive Program at Purdue, preparing the next wave of CNOs and nurse leaders. And here's really what makes Dr. Ludwig-Beymer especially perfect for today's conversation. She serves on the Transcultural Nursing Society, bringing a lens of cultural humility and global perspective to everything that she does. She understands that great mentorship isn't a one-size-fits-all. It requires us to see and honor the unique experiences that each person brings. Dr. Ludwig-Beymer, when you reflect on your journey from ICU nurse to now CNO, and then professor and magnet appraiser, who were the mentors that shaped your path?
So let me start by saying, please call me Patti. Yep. But further, please realize that I graduated from nursing school in 1973. I attended a diploma program. We did not talk about mentors. To my knowledge, mentors were first acknowledged in the nursing literature in the early 1980s. So I was in practice for close to 10 years before the concept had even become embedded in nursing. And so I will tell you, in my diploma program, I had several faculty who I wished to emulate, who were key in my development as a nurse, but certainly they were not labeled as mentors. As a new grad, I was oriented by a group of stellar nurses, and I learned a great deal from them. But again, the totality of what mentorship really entails was not part of the vernacular at the time. So my first mentor formally was a classmate of mine in my doctoral program. And she remains a mentor to this day. She is still someone who I go to and we talk about issues, we share perspectives, and she was only a year ahead of me in the doctoral program, yet she has made a huge impact on me as a professional. The other person I'd like to acknowledge is Dr. Madeline Leininger, who, as I became involved in the Transcultural Nursing Society, really took me under her wing and provided a great deal of support and opportunities to me. And then I also want to acknowledge a couple of people. One was a physician and one was an administrator. Neither of them were nurses, but I do think that we can learn a lot from mentorship within our profession and also outside of our profession.
Agree. I think collaboration goes a long way.
Yeah.
When was it that you knew that mentorship was going to be absolutely important in your career and others?
I would say in my doctoral program that once I formed a collegial relationship with Marge and realized how she was only a few years older than me, but much more talented in terms of life experiences that she had had. She had had international experiences. She had been a director of a program, a nursing program in Nigeria. She was just someone who really helped me grow in many different areas. So I think that's when I realized how important it is to seek mentorship and also to serve as a mentor.
Agreed. I think we really throw out the word mentor in a lot of nursing, but it can mean a lot of different things to different people. So how do you define mentorship, and how is it different from, say, precepting, coaching, or just being a supportive colleague?
So for mentoring, I think it entails having a long-term relationship. It is not something that is quick like coaching. I think of coaching as maybe I needed to develop my emotional intelligence. I could have a coach that would help me with that aspect of my development. Whereas mentoring is longer term, it's more holistic, it's looking at your whole development as a professional and as a person. Precepting, of course, we use that term a lot in nursing, and sometimes we confuse precepting with mentoring, but precepting is also that making sure someone is safe and competent so that they can practice in their profession. And it really doesn't go beyond that, whereas mentoring is looking at that whole career navigation.
Yes.
As a teacher, I do think, my role is to provide knowledge, help students to acquire that knowledge and to integrate that knowledge into their own personal lives. And so there are times when I think I move towards that mentor relationship with, especially, the graduate, the DNP students. So that to me is kind of the essence of the differences in mentoring and precepting and coaching.
Wonderful. Thanks for explaining all of that, because I do think that it gets confusing and people do use them interchangeably. As I said in the opening, you've been in nursing for decades now. And so how has mentorship really changed nursing over your career? You said in the beginning you didn't have it, and now we do. And are we doing it better, or are we doing it worse, or is it just different?
Well, I think we've learned along the way a bit about mentoring. And we took that from some other professions, which I think is fine. We learned from many, many disciplines as we move throughout. But I think we are more intentional now, that we actually look for opportunities to mentor others and serve in those kinds of roles. And I think that the young folks that I work with are looking for mentors. You were a great example. Like you said, will you be my mentor? And I said, wow. So I do think that we are acknowledging the need for mentors.
And I've seen it grown both in practice and just within academia. I know recently more organizations are putting out there, do you want to be a mentor to someone within that organization? So I do think and glad that it's growing in general.
And I was wondering if this organization has a formal mentoring program, as I know that the Transcultural Nursing Society does, and ANA does. So wondered if you all.
No, the Nurse Practitioner Journal does not, but I think that they are starting to think about how we can really mentor the next writers and all of those that want to put into a journal and don't know how. Now, in your experience at CNO, you worked with NPs, CNSs, nurse anesthetists, midwives, and all other advanced practice nurses. So mentorship looks different in all of those roles. So how have you really combined it to make it more of a universal mentorship?
Well, that's a great question. And that I go back to Madeline Leininger's theory, which talks about universality and diversity. So those are diverse roles, but there are some universal principles for mentorship that we should probably acknowledge. I could never pretend to mentor a nurse practitioner in that nurse practitioner role because I am not a nurse practitioner. Same way with a nurse midwife. But some of the core things that I think various mentors can provide are around career functions. So I'm not going to be able to help you with skill development, but I may be able to hook you up with someone who can. I think it's important to step back and acknowledge that the mentor doesn't need to be the be-all and the end-all and the all-knowledgeable person for all aspects of that relationship. So when I would have a new APRN begin in my institution, I would hook them up with an experienced APRN who could work with them around their career functions. What I could work with them are some of their psychosocial functions, confidence, providing emotional support, providing that professional identity, opening doors for them so that they felt they belonged within the organization and that they weren't isolated. They were enmeshed in our organization. I could also help a little bit with the role modeling. So demonstrating professional behaviors. How do we behave as professionals? When you attend the medical staff meetings, how do you function as an APRN? You are representing your profession with that group. Really important. And then I think sharing my values in action. And, one of my values is the ability to learn in any situation. So remaining humble. You're not going to know it all. I don't care if you've been an APRN for 25 years. You're not going to know it all. And so that's okay. Acknowledge that and continue to learn and continue to develop.
And I think you can branch out your mentorship, just like you said, like we need a lot of different mentors to understand our role in general. You transitioned from clinical practice to executive leadership as a CNO. And so what did you need from your mentors during that transition that was really different than what you needed earlier in your career?
So earlier in the career, of course, my focus was nursing practice and being the expert nurse that I wanted to be. As I grew in administrative functions, that's where my mentorship from the chief medical officer in one of my positions became really important. And I learned from how he interacted with his physician colleagues. And so that sort of development that was important for me. And then I also learned from the CEO from another position where, again, she was very, very supportive of particularly women professionals, but that was a time when women were not as well positioned in the boardroom as we are now. And so I learned a great deal from her about how to function, for example, with boards of directors. Those interactions are different. The interactions with physician colleagues, they're different. So those people were very instrumental in my development, and that was what I needed to learn. Now, what I learned from my colleague Marge back in my doctoral program was writing. And so she was my mentor in writing. And as a staff nurse, a direct care nurse, assistant manager, and even as an educator, I really had not written much. So I learned how to organize my thoughts in a way that they could be communicated clearly. And she was my best mentor in terms of writing.
I think that's a hard thing for APRNs in general, because most of us are in practice.
Right.
And so we just don't know how to move forward with the writing. Again, you have to find somebody that knows how to write and then pull you into that.
Exactly. And she opened many doors for me. I even think we did an early podcast together before it was called podcast. But we did an hour interview on international nursing issues for a television program. And I never would have had that opportunity without her.
Yes. There's been a lot of conversation really about the difference between mentorship and then as sponsorship. So can you tell us where, mentors advise and then sponsors can advocate and open doors, kind of like you had stated earlier?
Right. So I believe that mentors should both mentor and advocate for their people. Again, it's opening doors for individuals where the doors may have remained closed without some sort of entry. So I think it's important to advocate. And, some examples would be advocating for someone to be in a particular position within a professional organization. This person is perfect to be your vice president. She is ready for this. So mentors support, but they can also advocate.
I agree. And I think that we need to start lifting each other up more so, because we all usually know someone that would be great at one position, and yet we kind of sit back and we're kind of scared to go out there and say this person really could do great here. One of the biggest barriers that I really hear about mentorship, even from mentors as well as mentees, is that I just don't have the time. And as an educator and former CNO, you know how stretched you can be, and nurses in general are. So how do we make mentorship more sustainable for all of us, and especially within the context of our current healthcare environment?
So that's another great question. What goes through my mind is that being a mentor is not just about altruism. It's not just about giving. It's also about receiving. And so I think as a mentor, as professionals, we make time for what's important to us. And if it's important for us to modify, make changes, enhance the next generation, then we make time for that. But by the same token, we need to get something from it. And so for me, the mentors that I've mentioned have been in positions that have been higher than mine at the time. But I do think that mentorship can also be non-hierarchical. And I think of us as an example. So you say that I'm your mentor, and a wonderful mentor. I think I have helped you in some areas, but you have helped me in areas as well. And I think part of that is the mentor's ability and willingness to stay humble and the willingness to learn. So I think about one of the things where you've really stretched my mind is in all the technology. And because I've been a nurse for 50 some years, I didn't grow up with as much technology. My daughter is still shocked and appalled that I didn't own a computer until I was 35 years old, because that's just been a part of her life.
Yes.
But your embrace of technology has helped me to really try out different techniques with my students that have been very beneficial to all of us. So I thank you for that. And so I think that that's the kind of long-term relationships that are important in that mentor-mentee relationship.
I think you can grow together too. Yeah. Not all mentorships work out the way that we would like them to. And sometimes there's just a mismatch. And sometimes boundaries do get crossed, and sometimes expectations just aren't met. So what are the warning signs of an unhealthy mentorship or relationship? And then how can we help someone navigate those?
So probably the big red flag for me is when the mentor meetings slip. When they just keep getting postponed. So then you realize this is not being seen as beneficial to either the mentor or the mentee. It can slip both ways. And when that happens, then it really calls for, as we say, a crucial conversation. So, a mentor relationship, depending on the formality, we often have, these are the goals that I want to achieve. And then we have to go back and say, are we achieving those goals or are we not? Is there something that's missing? Where can I help you? Is it time to move to a different mentor or a different kind of relationship? So I think that communication is what's key in terms of turning that around. And I think it's safe to say, at least in my opinion, that not all mentor-mentee relationships are going to work. And it's okay to say, this is not what I was looking for. Thank you so much for your efforts. It's been a great opportunity to work with you. I'm going to look for other opportunities as well.
And even the mentor could say, I know someone else that might be of more benefit to you.
Exactly.
I know that was one of the key things in the beginning of our mentorship relationship, is that you always made sure that we met monthly, and there was always an hour on our calendar from the beginning of the year to the end of the year, so that those kind of things don't slip, because I think that's what happens. Schedules fill up, and then that's the last thing on the list to then fill that in.
Yeah, that time has to stay sacred.
Yes.
And, it can be an hour, or it can be a 15-minute chat. It can be over coffee. It can be a formal meeting with an agenda. It really is determined by the mentor and the mentee. but it's really essential to carve out that time.
I agree. Research shows that nurses really underrepresent some of the backgrounds, and they often face even more barriers than what we've already discussed. So with them finding mentors that really understand their unique position, how do they go about learning leadership and getting a mentor that fits them?
So I do think that part of that responsibility or the onus of some of that lies with the actual organization and the leaders in the organization. And I'll give you two examples. When I was at Edward Hospital, we had a very robust, they still do, have a very robust shared leadership, shared governance structure. And we had a very powerful professional practice council. Changes were not made in practice without input from that professional group. And the group was always co-led by a direct care nurse and by me as the CNO. So I looked for opportunities to raise up nurses who might otherwise not be considered for those positions and may not even have considered themselves for those positions because of, historical kind of blatant discrimination against key groups. And so one of the nurses was an African American from the emergency department, and I approached her and I said, how would you feel about chairing this group? And she was very flattered and did a phenomenal job. And then about 6 years later, the term of office is 2 years. So a while later, I approached a Filipino nurse who she had such great background because she was in the float pool. So she went to all of the different units within the hospital, adult units, med-surg, telemetry, and critical care. And she said, I'm not good enough. I don't know enough. And I said, together we can really do this. And I will tell you that both of those individuals went on to earn their master's degrees and are in positions of responsibility and accountability because, I won't say because of, but partially influenced by their ability to lead a key organizational unit within the hospital.
And having someone like you pull them from the corner and say, it's okay to stand out here. There's a point in all nurses' careers where they shift primarily from being the mentored to wanting to be a mentor. So how do you know when you're ready to actually be more of a mentor than a mentee?
On a good day, on a bad day, you say, I don't know enough. And I think that that's a common flaw that we have within ourselves, to sometimes doubt our own abilities. And so I would say, consider being a mentor in an area of your expertise. I got to be a really good writer, so I got to mentor a lot of people in writing. And now the mentee has exceeded the mentor. You have 3 books under your belt. You have 30 plus publications. But I think that we have to be humble in our approach to mentoring, but we also have to acknowledge that we have areas of expertise. And that's not bragging. That's just acknowledging the facts. And I guess the other thing is to know that we're never going to know it all. And if we wait to mentor until we think we know it all, we're never going to mentor.
Yes. And we'll lose a lot of people from pulling them out of the corner.
Right.
Now that you are teaching graduate nursing students, you're really essentially mentoring a whole new generation of advanced practice nurses and leaders. So what do you think are the essential skills or qualities of an effective mentor? And are these skills something that we're born with? Or are they something that develop over time?
I think the skills develop over time. I think that we're born with some aspects, but we're constantly looking to enhance. So one of the key things that I think of with a mentor is the ability to really have that emotional intelligence. So I need to know how I come across. I need to know where my strengths and weaknesses are. I need to know what the points are that my trigger points, what drives me crazy. And I need to be able to listen. So I think sometimes people assume that mentors are going to solve all the problems for the mentee. That's not the case. Mentors are going to listen and they're going to reflect back. I think, hold up a mirror. What do you see? What are you hearing? What are you thinking? And then let's work on this together. So to me, that emotional intelligence that the mentor really needs to have, and then the ability to be honest and help the mentee reflect.
Well, I think that grace can go a long way on both sides.
Yes.
Some organizations have formal mentorship programs where people are matched, and there's really a structure around a relationship between the mentor and mentee. And then others rely on more of an organic experience. So you've probably experienced both. And so what are the advantages and pitfalls of each?
Well, I actually, as a mentee, I have not experienced both because mentoring was really new and I was never assigned a mentor in any of my positions. So the examples that I've given you are people that I sought out to seek support from. Now, as a mentor, I have been in both situations where the individual seeks out a mentor and one in which they were assigned. And I will say, you were assigned to me. And it just was fortuitous that we clicked as well as we did, and we moved forward very effectively. I've been in situations where a mentor has been assigned to me, and we have not clicked as well, and it hasn't been as productive. So I do think, obviously, there are strengths and weaknesses to both approaches. I think the major strength to the assignment piece is knowing kind of the acknowledgement that, hey, mentors are important, and we can put you in a position where you can have a mentor. So that sends a strong message that, hey, we really do believe in your professional growth. We're here for you and we want you to succeed. The pitfall is if that relationship does not work for whatever reason, then it's ineffective. But I think the best of both worlds is to have the ability to augment your mentor as needed. And we've already talked a little bit about that. I can't help you with anything technology. You sought others to work with.
Younger. The ones that are like doing things that I've never heard of.
Yeah. So I think that's a nice blend. And as long as people's egos stay out of the way, if I were more of a controlling person, I'd be really hurt that you would need somebody else. But the reality is we all need multiple mentors in the multiple facets of our lives.
I think that's what makes a good mentor, is realizing that we need a lot of people around us to help us rise.
Yeah. Takes a village.
Yes, it does.
To raise a child, it's a mentor, an APRN, right?
And nurses in general, right?
Exactly.
Now, the pandemic changed really how we connect with each other. And I know many mentor relationships that have gone more virtually. Do you think that mentorship can be as effective virtually as it is in person?
I actually do. I think about my own experiences, and I have mentored people across the country and now across the world. And so you couldn't do that in person. And it's all the more sweet than when you're at a conference and you get together and you get to see the person in person. That is like truly wonderful. But I do think that you can have a mentor-mentee relationship across social platforms, Zoom or Teams or whatever, and by phone. Now, you do miss some of the subtleties that you would pick up in an actual meeting.
Yes.
And some of the nonverbals that you don't always get to. But I do think that it's very possible. And in this day and age, I think it's really important to have those relationships across the world.
It certainly has open boundaries. Like you can meet with anyone, anywhere.
Yeah.
As a graduate nursing educator, you are preparing nurse practitioners and for a lot of different roles in leadership positions. And you also help doctoral students. So what role should mentorship play in graduate nursing education?
So that's where I do believe teaching kind of blends over into mentoring. So, we present content and we hope that students are going to embrace that content and learn from it and function with it. But they often need some additional coaching, which we've talked about, but also some mentoring. And I'm always really gratified when I hear back from my students who say, I sought a new position and what I learned from you really helped me prepare for that. I've also had students come back to me and say, I want to apply for this position. Do you think I'm ready? How would you suggest I get better prepared for it? And, I look at that. It's not as long-term as some of my mentor-mentee relationships, but it's helping them grow into their roles. So I do think that a mentor helps individuals grow into their role.
I know in graduate nursing, you taught me this, is if you see something wonderful that a student is doing, pull them out and say, this is what you could do with this, whether it be presented at a conference or write a paper on it. So I think sometimes we have to pull them out of their shell as well.
Well, it's the same as the direct care nurses who were not confident in their ability to lead the professional practice council. Sometimes they need that pat on the back. One thing that I try and do with my DNP students is help them identify, what journal would be meaningful for you in which to publish, and then focus them in that direction. So I think it's a mutual kind of a relationship where you can really help them to grow into the education that they've received.
We often think of mentorship as more hierarchical. Someone more experienced mentoring someone that really is less experienced, but there's also peer relationships and peer mentorship. So more where colleagues can come together and just talk to one another in different stages for one another. Have you seen peer mentorship in nursing, and when do you think it's the most valuable?
So I think peer mentorship is very valuable, and I don't think that we should abide by a hierarchical approach. I think even coming into PNW as an associate professor and you were an assistant professor, we still learned and taught each other, learned from and taught each other.
Yes.
And so I think that we can learn a great deal from our peers. As I've already said with technology, I learn a lot from my 30-something-year-old daughter.
Yes.
She's my mentor. She taught me how to do graphs and all kinds of fun things. So I think that we sort of have to ban hierarchical from our vernacular. It does not have to be the senior person who's always serving as the mentor.
Wonderful. This may sound like a strange question, but I've heard some people talk about the concept of self-mentorship, being more intentional about your own professional development and seeking learning opportunities by being your own advocate, especially in nurses in rural areas that don't necessarily have anyone as a mentor. So can you talk about that a little bit? What do you think of self-mentorship, and is it really a viable strategy?
So I have never thought of it as self-mentorship. I've thought of it as reflection. And so a good nurse at the end of the shift reflects back on what went well and what could I have done differently to help my patients. And that's one of the things that I try and inculcate in my graduate students in the nurse executive experience. So one of the things that I have them do is a portfolio. Well, we learned about portfolios many, many years ago. But what I have them do is really crucially look at where are the gaps in my portfolio. And then identify with the student. So the student and I identify, how can I fill these gaps? And that to me is a bit like self-mentoring. Instead of having someone else say, you're doing this really well, and here's some areas where, you still have some growth opportunities. They can do that on their own. So that's one of the assignments that they do for me. And they always come into it very chagrined because I tell them they have to have the category there, like presentations, publications, community activities, community volunteer work, committee work within their institution. They're all there. And they come in and they want to take that off because it doesn't make them look good. And I'm like, this is not about making you look good. This is about making you a well-rounded professional. And these are areas where if you haven't achieved, that's okay. But let's look at opportunities for you to achieve.
Wonderful. How do they feel about it at the end? Then if we have to
good with it.
Yeah.
At least they pretend to be.
They usually do, right? At the end, they're like, oh, I did learn something from that.
Exactly.
Now, from your CNO perspective, whose responsibility is mentorship?
Well, I see it as a two-way street. And as a CNO, I was very passionate about mentoring others so that, at some point I could step out of that CNO role.
Yes.
I feel the same way here, as a professor. At some point, I'm going to be wanting to retire, and who's going to step into those roles? So I do think that there needs to be a strong focus on mentorship by the mentor and by the organization. As I said, we need to give people permission to seek mentorship and view it as something that's viable and that's something important to the organization and to the profession. But simultaneously, the individual also needs to expend some effort. They cannot, it's not a passive kind of approach. People have to be willing to step forward, and they have to be vulnerable too. I'm vulnerable every time I seek a mentor. So people need to be open and need to express what it is they're looking for.
Open and honest. And I always say sometimes that stings a little bit, but when you go and self-reflect, you realize that it probably is spot on the way that that's coming. One of my favorite parts of this show is to ask you, what are one or two POWs, pearls of wisdom that we can give everyone out there?
So my POWs for the day would be, give it a try. You're not going to know whether you're a mentor or a prospective mentee. You're not going to know if it works until you try it. So what do you have to lose? Give it a try, approach someone, take them under your wing if you want a mentor, ask for help if you want to be the mentee. So give it a try. And then for me, really keep it a two-way street. It has to be beneficial to both entities. And, I look back on people that I have mentored, and I get a lot of gratification from knowing that they've been able to achieve some of their life goals because of the work that we've done together, the relationship that we've had together. But we also need to look at what else the mentor is getting from that relationship. So it can't just be gratification. It has to be more tangible than that. So keep it a two-way street, stay humble, know that there's learning opportunities for all of us.
As we wrap up, I want to ask you this. When you think about your legacy as a nurse, as a leader, and as an educator, how does mentorship fit into that?
So I don't think I'm leaving a huge legacy. I feel like I've done some good work, but I will say the legacy are the people that I've touched and how they have touched others. So in clinical practice, it's the nurses who are providing expert clinical care as a result, partially, of some of the work we've done. And in authorship and in leadership, it's the nurses who are moving forward and carrying that banner forward and making a difference to the profession, and mostly making a difference to patient care so that we can continue to evolve as a profession, continue to provide excellent care to the people we serve.
Know that you have made a difference, not only in my life and my career, but a lot of others.
Thank you. Thank you.
I really want to extend my heartfelt thanks for you coming on today and really sharing generously about your work as well as what mentorship means to you.
Well, thank you so much for having me. I appreciate it.
Until next time, this is Julia Rogers wishing you joy today and every day.
For more great content from the Nurse Practitioner, be sure to visit us online at tnpj.com for the latest NCPD articles, columns, and much more. Please leave us a 5-star review on iTunes and Spotify, as it helps with the podcast's visibility and helps us to keep bringing you this great content. Also, don't forget to follow us on Facebook, Instagram, and LinkedIn at The Nurse Practitioner Journal and on X at TNPJ_journal. This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed on this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer. Thanks for listening.